Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes, and these segments all bring you the latest advancements of healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. Before we begin with our special guest today, I'm very excited to announce that we'll be broadcasting the This Just In radio show again live from the HIMSS annual conference show floor on Tuesday, March 10th from 1 p.m. Eastern to 5 p.m. Eastern. This will be our 6th year broadcasting live from the conference, and I could not be more excited. And many thanks to my radio show sponsors, HIMSS, Lenovo Health, Intel, Business Radio X, and certainly Healthcare Now Radio. If you're planning to attend HIMSS, we'll be broadcasting from booth 2521, very centrally located near the main hall entrance, so please stop by if you're in Orlando and see the show. If you're not able to make it to the conference this year, you'll be able to stream us live at thisjustinradio.com between 1 p.m. and 5 p.m. Eastern. Last year, we had over 30,000 listeners, and it was a ton of fun and learning. We'll have another great slate of CEO, CIO, leading care providers, industry thought leaders, riveting authors, and certainly policymakers joining the show. Here are just a few confirmed guests: John Halamka, Paul Cerrato, Rasu Shresha from Atrium, Neil Gomes, Anish Chopra, Karen DeSalvo, Don Rucker from the ONC, Steve Posnack, Elise Sweeney-Anthony, Catherine Marchesini, and the entire ONC policy team, and many more thought leaders. So very excited. My guest list, many friends are returning to the show, and it'll be terrific and bigger than ever. So hopefully you can join us in some capacity. But without further ado, for this episode, my 192nd episode, we're very fortunate to have two healthcare pioneers and healthcare leading authors, Dr. John Halamka and Paul Cerrato. Welcome back to the show, gentlemen.
Thank you.
Thank you.
And so where are you calling in from, John?
Well, so I'm in Boston. See, my new life is that I work in Minnesota, but live in Boston. So this is the Sunday, Thursday commute. It's all doing fine.
Fantastic. And obviously, the Unity Farm Sanctuary is doing wonderful.
Well, with 70 acres, 22 barns, 250 animals, and 80 volunteers, my wife continues to run it just smoothly as I begin this Mayo adventure.
Amen. Excellent. I love it. Fantastic. And I follow you guys on every ounce of social media that I can. The animals, just what you guys are doing for just society, but obviously nature and so forth is fantastic. So thank you so much, John, for that. And Paul, where are you calling in from, my friend?
I'm about 60 miles northwest of New York City in a town called Warwick, New York. That's in Orange County.
Excellent.
Beautiful area, especially in the autumn.
Yes, beautiful, beautiful area for sure. So this is your fourth book together, gentlemen?
Yes.
Fantastic.
But Paul, it feels like we've been finishing each other's sentences for a decade or more.
You're so right. You're so right.
Very true.
We think very much alike on many issues.
It's excellent. So Reinventing Clinical Decision Support. Yeah, no, the book is Reinventing Clinical Decision Support. Is that correct?
Yes.
Excellent. So what motivated you guys to write this book about clinical decision support?
One of the things that motivated me was, I guess, what you would describe as righteous indignation. And the reason I say that is, I've looked at some of the statistics on diagnostic mistakes, and there's between 12 and 18 million adults in the United States every year who experience some kind of diagnostic error. And, that bothers me, as it bothers most healthcare professionals. Something needs to be done about this epidemic, and we are hoping that by improving clinical decision support systems, that it'll have an impact, basically.
Fantastic. And your thoughts, John?
Yeah, so I think back on what decision support has been in my life, and that is in the 90s when I was doing early AI. You wrote rules. And the challenge with rules is rules change, and rules are complex, and they're impossible to maintain. And so what you recognize is decision support going forward needs to be based not just on static rules, but dynamic patient experience. I think as we enter 2020, we know we're getting more data from more people with novel diagnostic information from wearables or patient-reported outcomes. And we need to incorporate that into our decision support going forward. So it's a whole new era with a whole new set of tools.
Very true. So you guys mentioned, different types of diagnostic errors that you're concerned about. Dive into that a little bit.
Sure. So first of all, that number that I cited earlier, between 12 and 18 million, if you dive a little deeper, that includes between 500,000 and 1 million patients who are suffering severe, life-threatening results from those errors. So we're talking about 3 separate buckets primarily. One is cancer misdiagnoses, the other is vascular disease, and the third one is infection. And there are approximately 4 major types of errors that we're looking at. One is a misdiagnosis. Second one is an incorrect diagnosis. Third one would be a delayed diagnosis, and finally an overdiagnosis. And all 4 of them can have serious consequences. So those are the 4 categories that we're looking at.
I had one quick comment, and so Justin, this is a story. So as a physician, I'm sometimes asked to help what I'll call distant, very loosely connected acquaintances. Can you help me navigate the U.S. healthcare system? So I get this phone call that says, oh, yes, well, a daughter was found running naked through a parking lot in California at 3 in the morning. She's in the emergency department. Can you call the physician? So I call the physician. The physician says, well, we ran a tox screen, and you know what we found? Cannabis.
Right. And
I, as a physician, know when I have a young person with cannabis, that completely explains every wacky behavior they have. And so this is what Paul's getting at, is that often physicians will make decisions based on anecdotal experience that has completely no basis in evidence.
Yes.
And so the physician discharged this woman. She came to Boston. We did a lumbar puncture. She had the worst case of meningitis anyone had ever seen. So we had a complete diagnostic error based on sort of irrational thinking and anecdotal experience.
Yeah. So let's dive into that a little bit. What are some of the, common causes? Can you name some of those causes of the diagnostic errors?
The list is pretty long. In the book, we discuss some of the more common ones, but sometimes it's something as simple as a noisy clinical environment. I mean, if you're in an ED or a clinic where a lot's going on and there is poor lighting and there's a lot of distractions, it's hard for the clinician to think, essentially. And some of these diagnoses really require serious quiet time in order to go down the right path. So that's an example. Patients who are uncooperative, that can contribute to it. Patients who lie about their signs and symptoms, that makes it hard to make a diagnosis. You ask a patient who you think might have liver disease, well, how often do you drink and how much? Well, the odds of getting an accurate answer to that are pretty small. So, but generally speaking, there are 2 buckets, there are 2 categories in which most of the diagnostic errors fall into. One would be called system-based mistakes, and the other are cognitive errors. So system-based mistakes, a good example of that is what we sometimes refer to as closing the loop or not closing the loop. So, for example, there are about 100 million referrals from a primary care doc to a specialist, but only about half of them are actually fulfilled.
Yeah.
There's all kinds of reasons for that, but that's obviously is contributing to the misdiagnosis problem.
Yeah.
And I would just add to that. So I went to medical school in 1984. A few things have changed since then, but there's more literature published in a day than a doctor can read in a lifetime.
Right.
So although everything Paul has said is completely true, part of our issue is science is advancing beyond the capacity of the human mind to digest it, and we need a new approach.
That's fascinating. So let's take that to another level. And you guys talk about cognitive errors and the role of cognitive errors and what they play in causing diagnostic errors. So why don't you dive into that a little bit here?
reasoning mistakes. There's actually a list of about 30 different cognitive mistakes that physicians and nurses can make. And those include things like premature closure, where the doc jumps to a conclusion too quickly without considering all the alternatives. Confirmation errors, where they get fixated on a particular diagnosis and then ignore everything contrary to it. So these are the types of errors that docs need to be cognizant of, and it's also errors that need to be plugged into the training of medical students.
Agree. What would you add to that, John?
Yeah, it's just that today, when a doctor is entering an order, that doctor will use experience that may be 20 years out of date to complete the order, as opposed to getting just-in-time evidence that will help them do the right thing. And a quick example of that is opiate prescribing. So imagine that when I went to medical school in 1984 and I was working with my chief resident said, 15 is a good number. Every time you have a patient, just write for 15.
Right.
And so of late, some of my colleagues have done machine learning models where they've taken the pills out of the medicine cabinets of patients post-op and counted the number of pills actually taken. So do you know what the right answer is for most patients? 2, not 15.
Wow.
And so what we need is this advice that says, I know, doctor, you've got a lot on your mind. You've got to get through this order really quickly, and you were trained 20 years ago. But for the patient in front of you, if you want to personally help with the opioid crisis, 2 is the right number.
Wow. That's fascinating. And for those just tuning in, we're speaking with authors Paul Cerrato and Dr. John Halamka about their new book, Reinventing Clinical Decision Support. So, gentlemen, you devote 2 chapters to AI, artificial intelligence, and machine learning. How are these tools going to improve clinical decision support and reduce diagnostic errors, in your opinion, in your research?
Yeah, I would say they're definitely going to improve clinical decision support. This is not a panacea, obviously, but there are so many tools coming out, and there's so much research to support the value of these things. We spent a lot of time talking about convolutional neural networks, and they're now being used to help create software systems to screen for things like melanoma and diabetic retinopathy. And because these systems can look at basically every single pixel in an image, I mean, it's impossible for any physician really to analyze images at that level. So this is why some of the researchers are showing that these tools are as effective as experienced ophthalmologists and experienced dermatologists in making diagnoses.
And the way I describe it, these AI tools do not replace clinicians, they augment them. And just a quick anecdote, my chief of radiology at Beth Israel Deaconess told me, when I was a resident, we would on average have 30 slices of every CT scan to review. Today, because of advances in technology, it's 300. And a mere human looking at 300 slices in a 10-minute period has created an impossible burden. And he said, I want a tool that will tell me, of these 300, here are 5 you should really study in detail, because it will make the practice of medicine possible again.
Wow. So going down that path, and this is just maybe an anecdote from, I think, the last couple of years I heard with AI and machine learning, is where and you might know about this research, is they have a study that came out that basically just talked about how the machine was picking up on certain patterns just because the pattern was put. I don't know the study, but I'm saying if you guys do know the study, where it actually wasn't picking up anything scientific. It was more noticing, I think it was some type of distortion because it's being placed the same way. The machine was picking up on the human behavior more than it was picking up on a disease of some sort. Do you know what I'm talking about there?
Yes. There are artifacts that can distort the machine's ability to read it properly. And in fact, some of the research has gone even further than that. They have found that you can deliberately create misleading results by adding in a particular type of image, or turning the image to the side, or backwards. And so obviously we've got to be concerned about those problems. It's even possible for someone to hack into a system and create what they were now calling adversarial results that would mislead not only clinicians but mislead healthcare insurers. So that's an area that really needs to be explored more deeply.
And as Paul says, the challenge with machine learning, it's probability. It depends on good data sets. It doesn't deal well with sparse data sets or inconsistent data sets. And so a quick example for you, in 2009, when meaningful use required us to reconcile medications for the first time, we now have medication lists that are longer than they ever used to be. You run machine learning on that and it says, oh my God, in 2009, everyone got sicker.
Right.
Well, no, human behavior changed.
That's right. Very, very good point. So, John, in simplest terms, you describe machine learning as pattern recognition. What do you mean by that?
So, the challenge with multivariate systems is that the human mind can recognize about, 5 changes at once. Paul, I don't know what you think about this. It can't recognize 1,000.
No, I would have to agree with that one.
Right? And these things may be subtle, right? And so what you can do with machine learning is take a complex longitudinal patient record and detect across a cohort of patients changes that may be multivariate and beyond the human mind to recognize. Again, all using statistics. And here's another quick example for you. Can you diagnose Alzheimer's using any blood test in 2020? The answer is you can't. But a whole lot of combinations, the blood test and your CT MRI image and what might be amyloid deposits in the brain and cognitive testing and other things all together can generate a probability, a Gaussian distribution that you will develop Alzheimer's. No human could do that.
Excellent. Paul, do you have anything you want to add there?
No, I think he covered it pretty well.
Excellent. So, and actually you make me think, John, about how I've even noticed, and even in the coming last weeks and months, of how biased my brain personally is. I won't speak for myself, but how biased my brain is I see things that I want to see, and I'm comfortable with seeing certain things, and knowing that about yourself is very important. And so I even have this recognition of how my brain sees things and reads things, and is just which is inherently biased. So
here's a peculiar observation for you. So I'm an MD. I've earned 7 different degrees over the course of my life, and why? It's because I'm really good at understanding the way tests are written. And that is, I'm not studying the material, I'm studying the test writer.
Exactly. That's great. So, now taking a step back into the real world a little bit, also in your daily practice, what are Beth Israel Deaconess and Mayo Clinic doing with artificial intelligence and machine learning, and how are these initiatives going to improve patient care? I'd love to know that, and my audience would too.
Oh, certainly. Well, I'll start off with a couple examples. So at Beth Israel Deaconess, there's been some work done with Amazon. And just to be clear, that isn't giving the data to Amazon. It's using Amazon tools and a secure hosting environment to come up with interesting knowledge.
Yes.
That helps us understand what level of acuity our patients are when they present to the hospital, when they're likely to get discharged from the hospital, if they'll make their appointment or they won't make their appointment. And this is, again, pattern recognition, looking at millions of patients of the past to forecast behavior of the patient in front of you. And it's working really well. I mean, you're looking at, what we would call the AUC, the area under the receiver characteristic operating curve of, 0.9. I mean, so in other words, these things are really good. Mayo has hundreds of machine learning algorithms developed by its clinicians. And let me give you an example. We can look at your lead 1 ECG, and we can decide if 6 hours from now, you're likely to have a problem with congestive heart failure. And these are so subtle, no human can even see the pattern.
Wow. That's impressive. Very cool. So anything you want to add there, Paul? I know that you don't work there, but anything you want to add?
No, I was actually thinking about some of the hype and some of the shortcomings of AI and ML. I wanted to talk about that, but I'll wait until you decide to get to that.
Yeah, we're actually going to get to that probably in our second segment. So I'll leave that as a cliffhanger for the audience because we're going to have a round 2 next week. But I do want to quickly transition over. I know we've got about 5 minutes, so I don't need to rush too much. But I would love to talk about HIMSS 20 because that's the annual conference is coming up. And obviously the 35, 40,000, 50,000 of us are gearing up for a tremendous conference. So let's put on the crystal ball. That was actually one of my most popular shows I did with you guys a couple years ago. And obviously you guys are obviously frequent guests at the HIMSS conference and the radio show. But I would love to talk about some of the themes that you're expecting to see there. Obviously your book, you guys will be speaking several times on Reinventing Clinical Decision Support. But also, what are some of the themes or trends that you guys expect to see? So I'll start off with you, Paul. What do you think you're going to see, or what do you expect to see?
One of the things that I expect to see is talk about the transition from patient care in brick and mortar environments to virtual care.
Yeah.
It's getting to the point where hospital care is so incredibly expensive, and it's got all sorts of potential complications. And as AI and machine learning start to take root in mainstream medicine, we're going to see more and more healthcare professionals move to the telemedicine environment and to various other virtual settings. And patients are going to take more control over their care because they're getting more educated and they're getting tired of being treated paternalistically. So I think that's one of the themes that we're going to see growing at HIMSS 2020.
It's fantastic.
Sure, and I have long said that we're in the post-EHR era.
Yes.
And EHRs are fine. They're transactional systems that help with billing and compliance. But the interesting things at HIMSS will be the tools surrounding the EHR. And that is, what are the novel clinician burden reductions, like ambient listening? I walk into a room, I talk to a patient, the chart is filled out for me. Or, as we've been talking about, the machine learning tools that will say, well, I've digested the results of this particular visit, and there's an 86% chance that the patient has this and a 42% chance they have that. And so, clinician, you make the decision, but here's a set of guidance. The EHR is not going to do that. It's a tool on top of the EHR. And as Paul said, we're going to see increasing use of novel sources of data, the wearables, the Internet of Things devices in the home as care becomes more virtualized.
Fantastic. I completely agree. I mean, that's the side of the area, managing that care journey for the patient, and then certainly injecting intelligence, artificial intelligence, machine learning, and those different types of, evolutions in where we're going in technology. I completely agree. So, and not to put you both on the spot, but do you actually, I would love to be able to promote if your sessions aren't already full, I'd love to be able to promote your speaking engagements. Do you guys happen to know that off the top of your head? Again, I'm putting you on the spot.
On Monday, we're speaking at the pre-conference on AI.
Excellent.
So I believe that's at noon on Monday. And then the general educational session that we will be giving will be on Tuesday. And I believe that is at 1:30 p.m. So on the first one, the pre-conference one, I'm going to dive deeply into data analytics, and then John, I'm sure, will be talking about his work at Mayo Clinic. And then the second presentation, we'll talk more generally about AI.
It's fantastic.
And I'll be around for 3 days, and I never know what my schedule quite will be until about the night before, but I look forward to joining Paul in several sessions, and I'll likely have several. Gianrico Ferrugia, my boss, the CEO of Mayo Clinic, will be doing the opening keynote at HIMSS this year, so you'll want to attend that.
For sure.
Oh,
yes.
And the last thing we should mention is that we're doing a book signing at the HIMSS bookstore on the exhibit floor. So if anybody is interested in getting an autographed copy, we'll be there.
Excellent. Fantastic. And you both certainly will be on the radio show on Tuesday, March 10th. And we'll be announcing that run of show here soon, but an amazing overall guest list. But gentlemen, we will close today, but we're going to have you back on air for next week. So stay tuned and sit tight. But obviously, I truly appreciate you both being able to join today and taking time out of your very, very busy schedules to join the show. But again,
thanks for having us, Justin.
Yeah, no, thank you, Paul. And thank you to everybody who's listening and joining the show. And please, again, tune in weekdays and certainly next week for the conclusion of my conversation with Paul and John about their new book, Reinventing Clinical Decision Support, as well as a glimpse into what John has in store for his new role as the president of the Mayo Clinic platform. And thank you all for joining us. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so you can respond to your comments from the show. If you missed any of this episode or want to hear more, all of my shows are posted at Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. Also, you can check out the website that we've launched at justinbarnes.com. Thanks, everyone. Have a terrific week, and I hope to see you at the HIMSS annual conference.